I'd now like to introduce Associate Professor Peter Connaughton. Peter is President of the Australasian Faculty of Occupational Environmental Medicine. He's a consultant occupational physician working in private practice in Perth, Western Australia. He consults to the mining sector and has previously also consulted to oil and gas, healthcare and insurance sectors. He's an adjunct associate professor at the School of Medicine, the University of Notre Dame, Fremantle, and he studied occupational medicine at the Institute of Occupational Medicine in Edinburgh. He has a master's in business administration from University of Western Australia. His special interest is in the implementation of workplace mental health strategies, vocational rehabilitation for complex cases, and the evaluation of occupational health interventions. And he serves on the board of the Royal Australasian College of Physicians. Welcome, Peter.
Thanks very much. 2 years ago, in September 2 years ago, I was in the Pilbara of Western Australia, and I'd been invited by the mining company that I consult to give a presentation on mental health in fly-in, fly-out workers. And it was in conjunction with emergency response training, so their fire and rescue teams were all together, in fact, for a competition. So they had the fire and rescue, emergency rescue teams from about 10 different mines in one location, and we decided to have sessions on mental health. And it was an early start. It was about a 6 a.m. start for the first group. And on the Friday night, one of the workers committed suicide. And that was one of a series of suicides that's happened in FIFO workers in Western Australia. And so we had to decide on the Saturday morning whether or not we'd run the course. And this was one of the guys in one of the teams. Anyway, I put it to the groups and they said, yeah, you're here, we want to hear about it. And over a period of time, both prior to that and since then, there's been an enormous amount of publicity and focus on suicide in fly-in, fly-out workers. And that's the area that I work in. And these are very personal stories of young people in their 20s and 30s who are found dead in their room or hanging from a tree in the Pilbara, or equally distressing, killing themselves on their time off. And this has had broad publicity and a lot of investigation and discussion and soul searching, and we are a long way from having the answer to this, but I want to share with you today some of the conversations that we've had, and I'm not for a minute proposing that we have the answer, but we have some better questions now, and I'd like to share them with you. So the theme of this Congress is disruption for healthy futures. So I thought, I wasn't really sure what disruption meant. And so I had a think about and spoke to a number of colleagues, and I thought, well, hopefully some of you will go away from this thinking differently or having some different questions or different conversations, so that we might be able to put our hands somewhere and less people in the health system fall over. So what I'm going to propose to you, I propose when I was thinking about this was perhaps we should think about what are some of our barriers as doctors to, and in a community and in organisations, to lead to healthy futures. So what I'm arguing today is we perhaps need to disrupt our thoughts, and we need to disrupt our paradigms, and we need to disrupt the way we do things to get to that target. So I'm going to talk about some of the barriers, and as I say, consulting to mining industry, we've not been short on barriers. So what I'd like what I'm hoping at the end of the session is that you will go away questioning some of the paradigms that you have, because I've certainly had to question the paradigms that I have. And talking as a doctor to a mining industry, we have different languages, we have different concepts of the world, we have different ways of doing things. And my argument today is that the mining industry has learned some lessons that will be useful for us in healthcare. Now that's a strange thing to say, because when I began work with the mining industry, we were killing lots of people. And in fact, the statistics show that now the mining industry, in terms of workers' compensation, fatalities, and injuries, is safer than healthcare in Western Australia. The mining industry is now safer than healthcare in Western Australia. Have we got it all right? Certainly not. So these are sort of some of we had some discussions and so, well, what are the current paradigms? We talk about mental health crisis, we talk about what can we do, we talk about work being just so stressful. And I think it's fair to say those are paradigms for lots of people. A crisis, what can we do? But what does that mean? What do people, when they talk about those paradigms, what are they actually thinking? And I used to think, well, there's a crisis, so, okay, so that's too big for me. And I think that's a paradigm that we have. What can we do? The other side of that is, well, there's nothing we can do. And work's so stressful, the paradigm for a lot of doctors is work's bad for you. Let's get that clear. We see people with work injuries, so we know work's bad for you. What I want to argue is at the end of this, I think we need to rethink all of those paradigms, because I think they're unhelpful in us reaching solutions. There's a big crisis, it's too big for me. Really, let's be honest, there's nothing much we can do. And we all know work's bad for you anyway. And that's what I want to question. So it's just all overwhelming. It's on fire. There's no one in the clinic. We're going to go over the waterfall anyway, and let's just carry on. So what I want to argue is, in terms of mental health crisis, there's lots of other crises that we've dealt with. Lots of other crises. We've dealt with RSI. How many cases of RSI do we see now? How many cases of silicosis do we see now? Sadly, about 20 in Queensland, compared to, say, 4,000 in provinces in China. And we have dealt with crises in terms of motor vehicle crashes. We've dealt with crises in terms of work-related fatalities, and I'll show you some statistics. What can we do? Well, I'm arguing that we could adopt some processes that we've used in some of those other crises. And work is so stressful, I want to talk to you about the policy of our faculty, talking about the health benefits of good work, which is aimed to turn that paradigm on its head. So I don't think we need to argue that Australia has a big issue with mental health. I don't think we need to talk about that anymore, because there's lots of evidence about it. Now, I want to take a step back and quote Simon Sinek. Simon Sinek has done research on organisations that are very successful, and that's his interest in the business area. And every organisation knows what they do. We all know what we do. Some organisations think about how they do it, and the really successful organisations know why they are doing it. The why for us, in my opinion, is that we have a responsibility to our friends and our colleagues and our trainees to do much, much better at mental health. So if we want to be an effective organisation or group, we need to be really clear about the why, and then we'll talk about the how and the what. So what other crises have we dealt with? These are work-related fatalities. Is that good enough? Nope. But it's on a very significant trend down, and that didn't happen easily. That happened over a long period of time, and there are better graphs than that, but work-related fatalities are really coming down. These are all Australian road fatalities. Oh, the road toll, road crisis. Look at the figures. We do have systems for influencing really big population-based problems. How many cases of RSI do physicians see now? Not a lot. How many cases of lead poisoning do you see? How many cases of arsenic poisoning do you see? Etc. Do we have an HIV crisis? So, I argued we should adopt some processes that have worked elsewhere. This is primarily for the physicians. There's been work, Safe Work Australia has published a really good research on mental health disorders in Australia, and I won't go into that in detail, but the physicians should read that and know about it. And again, there's lots of facts. So we've focused our attention on the cost, the frequency, the duration, etc. There's plenty of information. Are we doing enough? Are we doing anything? And so there's the percentage of workers' comp claims, and look at 21% healthcare and social assistance, workers' comp claims for mental health, public administration and safety, education and training. That's disgraceful. And so we need some information. We need to go approaching this in a scientific, evidence-based way. We're doctors, that's what we should do. And I acknowledge my friend and colleague, Dr. Bláthnaid Hayes, who's the Dean of the Faculty of Occupational Medicine in Ireland, who has a study of 1,800 hospital doctors, and said, let's go and look at them, and let's go and research it, and that's what we should be doing as doctors. What's the problem? How big is it? Who are they? That's the first step of any scientific inquiry, and congratulations to the Irish faculty for that. We did a study in the mining company that I work with, and we've got a population of about 1,700 miners who volunteered, and we've looked at Indigenous, non-Indigenous, fly-in, fly-out, residential, non-residential. Very nice study, and interestingly, the single biggest predictor of mental health issues in the workplace was poor relationship with the leader. So instead of spending money on resilience or, toughen up, the organisation spends money on educating the leaders, not the workers. And so I think we need to be really clear about what interventions we're going to do. We don't have evidence yet of whether that's worked or not. But I think as doctors we've got to go looking and doing a bit of research, don't we? And okay, so part of the argument then is adopting a systematic approach. And there are resources out there. There are resources available now, developing a workplace mental health strategy, and it talks about having a policy. What do you want to achieve? Have a vision. Get an idea of the size of your problem, where the problem is. It's a very, it's a systematic approach to approaching any issue. Get some facts, get some figures, talk to some experts, think about a process, think about a model for reviewing that. A standard model of business management you might apply to any issue. And I'm arguing, I know this isn't going to apply for all of Australia and for everyone, and this is obviously not a miracle cure, but we could surely apply this in the risk areas of healthcare and community care and for our teachers. And this is the document in New Zealand, Working Well, a workplace guide to mental health. So at least in the workplace, we've got some systems where we should be using this sort of information and data. And this is developing a workplace mental health strategy for health services. And this is evidence-based and researched. And when you look at it, you think, oh, that's kind of it's not too complicated. Have a policy, have a vision, have a working group, have a process, have a review mechanism. And you think, yeah, well, it's not that complicated, but we're not doing it. We're not doing it. And there's some really good tools around. This is the work of Maureen Dollard in Adelaide. And Maureen has developed a questionnaire looking at psychosocial hazards in the workplace. And she did this with the police force in Adelaide, going around and giving them this questionnaire and asking them about organisational factors in the workplace, so support, workload, management systems, management attitudes and so forth, and developed a questionnaire which you can actually predict a year or two in advance with reasonable accuracy how many claims they're likely to have for workplace stress a year or two out. So this is a model of occupational health. Go and look at what the hazards are. You know, if you're working in a dusty environment or asbestos, you wouldn't tell patients, oh, well, you know, go swimming, that's good for your lungs. There are models for looking at workplace risk factors, and are we using them? Not much, not much, and a predictive tool. So my final and third paradigm change is, thank you, Sky, the third paradigm change is the Faculty of Occupational Medicine has a policy document called the Health Benefits of Good Work. And this is to think about the paradigm of, for most people, work is good for them. So as a doctor, if someone's unwell and you think you're doing them the right thing by certifying them off work for a long period of time, there's a lot of evidence that that creates harm for a lot of people. So, but it's more than that. The Health Benefits of Good Work, and it's downloadable from the website, has a consensus statement on the health benefits of good work. And the why of this is not for workers' comp insurers to shove people back to work when they're not fit. It's twofold. It's to remind doctors that most people, and doctors struggle with this because most of us love our jobs and most of us are passionate about our jobs, and most of us are fortunate that we don't, you know, work sorting rubbish or working down a coal mine or sorting out hospital laundry and linen. So we have a sort of cognitive bias there about work. But the real why for this is a feedback loop, if you read the wording of it. We're trying to encourage employers to think about how they can make workplaces better and safer and happier and healthier for workers. So what's good work? Good work is a safe, healthy, engaged and productive workforce that makes a positive contribution to the health and well-being of the worker and those affected by the worker. And what we've done is developed what we call a signatory group in Australia and New Zealand, where employers are now signing up to the principles of good work, saying it's a one-pager, it's worth reading, it's a vision aspirational document that even insurers and life insurers and miners, and I think we're up to about 350 companies and organisations around Australia now who are saying, we are committed to coming on the journey of creating work which makes people healthier and happier. Now occupational medicine is meant to be about prevention, and it's meant to be about health promotion. And this is the vision statement that is for organisations. And all of these documents are downloadable, and the uptake with organisations has been fantastic. Some organisations would like to do good things. And the interesting thing is they say, oh, well, this is independent. These are doctors. These are respected people saying this is what good work looks like. And sometimes we forget our sort of authority and that people trust us. And the conversations that this has stimulated, we would hope is going to change a part of the culture in Australia. And we'd love some of the health services to sign up to this and read it and think about it. And there's lots of other evidence. There's the Thriving at Work document from the UK, which is interesting. Creating employment environments where people get healthier and happier. And we've heard lots of stories about distress in workplaces, in doctors, and this is the opposite of that. This is questioning the paradigm. And this is a signatory group of insurers and all sorts of people who have signed up to the health benefits of good work. So my argument is that we need to change some of our paradigms if we are serious about disruption for healthy futures. I think we need to think about, what are our paradigms and how are those paradigms in our heads as doctors perhaps barriers to health of patients and populations. And so I'm arguing that the mental health crisis is a crisis, but we've dealt with lots of crises. Do we have a magic bullet for it? No, but there are processes that have worked elsewhere for other crises. And yep, work is stressful, and so work can be stressful. Work can be good for people, work can be good for communities, and we have a responsibility to look for those work areas that are really stressful and are making people sick and to begin to address it. And this is the doctor saying to the patient, I'm afraid you've had a paradigm shift. So thank you for listening.